So this is a very exciting phase 2 study using the regimen containing Mosunetuzumab and Polatuzumab. Both are targeting B cells, but with different mechanism of action. The Mosunetuzumab is a bispecific antibody recruiting T cells, and Polatuzumab is an antibody drug conjugate targeting CD79B and deliver the payload, so killing the target cells via different mechanism. So when we combine these two in this, this is a primary analysis of the full cohort with 42 patients enrolled into the study. Among these 42 patients, these are all relapsed refractory mantle cell lymphoma patients. They have at least 2 prior lines of therapy. They all need to have a prior anti-CD20 antibody, need to have either anthracycline or bendamustine-containing regimen, and also they all need to have the exposure to BTK inhibitors. So 100% of them have prior BTK inhibitor treatments. And in these 42 patients that were treated on this phase 2 cohort, we see a pretty difficult to treat patient population. 71% of them have 3 and higher risk factors, and this including a high MIPI score from 6 and higher, including patients patient have action nodal or bone marrow involvement, including patients with elevated LDH. And we also see almost around 30% patients already have prior CAR T cell treatment, and also similar percentage of patients have prior autologous stem cell transplant. So despite these high-risk features of the treated patients, we see extremely high efficacy with a CR rate of 79% and overall response rate 87%. So in this heavily pretreated patient population, and when we break down the patient into elderly age, elevated LDH, TP53 mutation or deletion, high MIPI score, across all these high-risk groups, the high efficacy is really persists throughout all these groups. So the results are quite satisfactory. When we look at the safety profile, Mosun Polo actually had a CR rate of 44%, which is actually quite, compared to other regimens using bispecific, this is actually quite favorable. And all these CRS rates are low grade, grade 1 and grade 2. And some patients had neutropenia, but febrile neutropenia was only seen in 5 patients, so 2%. And so therefore, we think this is a regimen that's highly efficacious and also quite safe to give in the outpatient setting. There's no hospitalization requirement. It's also given in a fixed duration fashion, a total of 17 cycles. Polatuzumab is given on the first 6 cycles. Mosunetuzumab is given for a total of 17 cycles, and that's it. So it's fixed duration, and we see very nice B cell recovery once the patient completes the treatment. So by 9 to 12 months post-treatment, almost the majority of patients already have B cell recovered to normal range. So this is a regimen we're very excited. We hope to bring this regimen to be tested in a broader mantle cell lymphoma patient population and also at earlier lines of treatment.